think this started recording for me right away. Okay, so I've got a red recording symbol in the top left. And if you see that too, I think we're good.
Yep.
Our second guest, Diana, you're our second guest. My first one I did last week with Tanner Neubauer, who's an alumni and a healthcare administrator in St. Louis, actually. You are our second guest. Welcome to our class, I guess. This is the Health Career Exploration class. And Diana, if you could just take a second and introduce yourself, tell us where you work and what you do.
All right. Hey, everybody. My name's Diana. I am in what they call an MLS. Us in the medical field, we like lots of initials. So it's a medical lab scientist, or they call it a medical lab technologist. So what I do is I work in the laboratory up at, it's mHealth Fairview now. It used to be just plain old Fairview, but we merged, so we switched the name. But basically, once I get into like which different careers there are, I'm working more of the background. So I do a lot of blood bank and microbiology and hematology and more of the background stuff. Whereas usually when you go to the lab, you see a phlebotomist who will draw your blood and that sort of thing. So we're kind of in the background.
Okay.
So that's where I work.
We probably should have talked about this quickly before I was recording here, but what I'm going to do is I'm going to start with a question from this deck of cards. They're all conversation starters, and they're called Chat Pack.
Sure.
And it's not a very deep question. Should be kind of a simple answer, kind of fun. So this question asks, if you could float in a hot air balloon over any city or place in the world, where would you choose to float?
Oh, Ireland.
Ireland, I like it.
Ireland, it's a bucket list.
Yes, nice.
Pretty boring, but
I think Europe in general is my bucket list, and then maybe I'll narrow it down
pretty
from
much.
there.
It's like, well, I don't want to be up in the mountains too long. I mean, I love mountains, but being on the ground. I don't want to be up in a hot air balloon in the mountains.
Yeah.
So, yeah.
So I guess what I would kind of like to start with is the presentation you shared with me. If that's okay. I don't know if you have that pulled up, if you could share your screen.
I have a printout in front of me. Yeah.
Okay. I think what I'm going to do is I'm going to start sharing my screen, because I can, and that way, as you talk through the presentation, we can see it on our screen here. So I'm going to say a Chrome tab, and okay. Can you see my screen? Can you see, does it say clinical laboratory careers and look like your
it sure does.
Okay. So, as you go through this presentation here, there's 9 slides. You just tell me to scroll and I'll scroll to the slide you want me to go to.
You bet. First, I'm going to just talk about what my background is, if you don't mind.
Yeah, sure.
So I kind of did things backwards. So I went to college and got a 4-year degree in microbiology up at NDSU, go Bison. And sorry, I had to get that plug. And then I worked at a research laboratory down at the University of Minnesota, or Minneapolis Medical Research Foundation. And then I worked there for about 6 years until I had my first daughter, and then decided to stay at home with her for a little bit, and realized I didn't want to be driving down to Minneapolis while living in Zimmerman and missing out on their lives. So I went back to school and then worked on my MLS degree. So basically the difference is accreditation. So you need to have more clinicals, and then you need to take an exam. So I did that, and then I got hired at Fairview. So that's where my background was.
Can we rewind just real quick? I can't remember if you said what your degree program was at NDSU. That'd be your undergraduate degree.
It's microbiology.
Okay.
Yep. So it is laboratory still based, but what I did in medical research was virology and that kind of stuff. So we actually had to do publications. And so I do have a background in that too, if anybody has any questions. And I did, as a temp right out of college, work at Boston Scientific for maybe about 6 months before I got hired there. So I do have kind of a unique background where I've worked industry and clinical. So if anybody has any questions about any of that too, feel free to shoot them off. So yeah, so then I got hired at M Health Fairview, and I've been there almost 9 years.
Okay.
So yeah. So what I kind of do, so clinical laboratory careers, there's kind of a range of them. I do love my job. I think I fell in love with it in what about 7th grade life science with Miss Perkins. So we had to do all the little, look at your planarias or whatever they are and under the microscope. And that's kind of when I fell in love with it. So laboratory I just loved because I kind of was a tomboy and I just loved bugs, hanging out. I had a neighborhood of boys, and we were always doing something with the salamanders and the window wells and out in the backwoods. So that's kind of where I liked it.
That's great. I love that. I love that you're able to remember your 7th grade science teacher. I think that's awesome.
Yes, heck to the yeah. So why is lab important in healthcare? Well, think about it. You go into the emergency room, you're having a heart attack, you need to get your blood drawn, and then we run the chemistries in our lab at the hospital. Some of the smaller clinical labs don't have that opportunity, but hospital labs do. I mean, if you're pregnant, you have to come in and take a pregnancy test. If you're having, knee problems and you have crystals in your knees, you have uric acid. So we do all of that in the lab. So 60 to 70% of all treatments and decisions are made based off of lab values. So it's a very important thing. And I can tell you right now, this is probably not updated, but it's probably double that right now, because with COVID, we literally have like a station down at the University of Minnesota where it is just a COVID station. So, and it's all laboratory based. So we have some of the nursing assistants collecting COVID testing, and then they're sent to the lab. So I'd say it's probably doubled. So job expectancy is probably about 28, I'd say closer to 40, to be honest. So
yeah, wow.
It's pretty crazy right now. So things are changing here.
I would anticipate our conversation would move towards COVID and our current pandemic situation. Because I'm definitely personally curious at how those changes have happened. But I'll write those down and jot some notes, because I think we'll spend some time talking about that soon.
Yep. Oh gosh, I'm sure we will. So degree options. So I always like to do this one as well to people that are interested in nursing, because this is a really good option. Phlebotomist or lab assistant, or at our work, they call them LCTs. I told you we like initials, abbreviations. Lab care technicians. So really, I think it's North Hennepin has a 3-month program. So you can even do it while you're in high school. So over the summer.
And that would qualify you to be a phlebotomist or a lab assistant?
That would qualify you to be a phlebotomist. So basically you take some classes, you learn which tubes are, each one of those tubes there has a different color top, and they have different chemicals in them, which help us do the tests. So basically our phlebotomists go draw patients. They're kind of a huck was what you call it, kind of like a lab receptionist. So they check you in, take you back. They help collect urines, blood, give patient orders. Some people need to collect stool samples. That usually gets a giggle. And then, ew. Yeah. And so, whatever it is, we collect it. So, it's kind of nice for nurses. So when you go into nursing, you have to learn how to put in an IV. So this is a kind of a really good beginner class to putting in IVs. So they can go take this class, a 3-month class, which is so cheap. And then while you're going to college for nursing, you can work as a phlebotomist at a hospital, because hospital phlebotomists are there 24/7. So if you have class in the morning, you could work evenings or weekends or overnights. So Fairview pays on the higher end of that. I know they're closer to $19, $20 an hour. But some of the clinics don't pay real well. And it also depends on where you are. The more rural you are, the less they're going to pay.
Okay.
To get closer to the cities, they'll pay more.
That's
So
I'm really glad you shared that, because I
yeah,
mean, just in general, 19-20 bucks an hour for a high school
as
kid
a
is like,
college student,
yeah,
yeah.
that's a great job. And
And then you're in the
also,
hospital. Yeah.
I had known about the certified nursing assistant as being good
Yep.
experience for kids considering nursing, but this is a great
Yes,
another option. So
it is.
I'll make sure to mention that to our kids, because I know that there's always a handful of kids in this group that are considering a career in nursing, or at least a degree in nursing to start. So
Yeah. Yeah.
thanks for sharing that.
Yeah. And then the second one is MLT. So that's just your 2-year program. And I know that North Hennepin has one. Who is it? Wilmer, I think, has one. There's a couple of them. So it's just a 2-year program, and you take your generals with it. And then they give you, you have certain time, I think it's 6 months for clinicals. And then it's just a little bit higher ups than phlebotomy. But I mean, at age 20, you could be making this. And then they also have at North Hennepin, they have what's called the 2+2 program. So you take your 2-year degree and then you get a job. And then if you work at Fairview, I don't know about Alina, but Fairview will actually reimburse you for your tuition. So they will help. And then you have to give them, after you're completed with your degree, you have to give them a year of your service, basically. So you have to stay on for a year before going anywhere. So, I mean, in 2 years, you could be making, $23 an hour and working at a job, and then do your evening classes like the 2+2 program. So it's really kind of nice. You don't have
Um,
like the college debt and all of
after
that stuff like
the
I.
after this, yeah, after the second year, is there an additional degree to that, or do you just end up with a 4-year medical lab technician?
There isn't that you just stay at that unless you go do the 2+2. After that is the MLS, which is the
Oh, okay.
next one.
Okay. Yeah,
So
that's what I was curious about.
yeah, it's just another option I know that North Hennepin has. So yeah, and I think it's St. Paul College has it too as well. So yeah, so this is the 4-year degree. So I was kind of grandfathered in, so I had a 4-year degree. So then I just had to do the clinicals, and then I had to take a national exam.
Okay.
So I was able to do that since I had a bachelor's already. So there's certain ways you can get it, but yeah, so this is the kind of like the 2+2. So if you have your MLT and you're working, and then you take these other classes, you can sit for this national exam for your 4-year. So
And is this
yeah,
where
and
you're at
then
right now? You're in MLS?
that is where I am at, yes.
Okay.
So I have that, and then we have to do continuing ed. We also have proficiencies that we have to do. There's actually a company that sends them out to us to make sure we're competent. We do have inspections. I think it's every other year from CAP, College of American Pathology, and all of those, JACO, and some of those that keep us working in the lab. But usually when you have an MLS, you get a little bit more like management opportunities or higher up. So it also depends on where you're at. So you can have an MLS and work at a hospital like I do, and you can do blood bank, you can do micro, you can do everything. So you're considered a generalist. You can get an MLS and you can go down and work at the University of Minnesota and do virology testing. You can do just plain microbiology, but that's all that you do. So you're specialized. So it's kind of what you like. And I kind of like the general, kind of knowing a little bit about everything. So it's not as boring to me,
Yeah.
but some people love it. So, and then here's the big wig one. We have several pathologists that come in. Most of them are down at Southdale, but they'll come up to Northland maybe once or twice a week. And we do bone marrows, frozen sections, and then fine needle aspirates. So that you have to go to medical school for. So you have to get a doctorate. So.
Okay. And is that, anytime you're doing medical school, that would be complete with a residency and
Exactly.
Okay.
Yeah. So basically that's your specialty. So you do your medical school, and then you go into pathology, just
Okay.
like any other, like dermatology and all of that. So yeah, so I talked about this a little bit. So you can go specialist or generalist. At a small hospital like I'm at, I'm a generalist, but I do on occasion have to go out and draw blood. When we're short, or on the evening shifts, we usually only have about two people, two techs there in the evenings, and only one on the overnight. So we will have to go out and draw. If you're down at the U, there's no way you'll even touch anybody. Sometimes you're just in this big warehouse type room and running chemistries and whatever. So it's whatever you like. They also have clinics. Usually there's not many MLSs working at clinics. It's usually a phlebotomist and an MLT, doing minimal work like pregnancy tests, and because like we have the Elk River Clinic and Zimmerman Clinic and Malacca Clinic, and all of their chemistries and tests get sent to our facility to run, unless it's something, big that needs to go out down to the university. So also American Red Cross or Memorial Blood Center, they hire MLSs. Minnesota Department of Health, Mayo hires a lot of lab people, private laboratories. So when we have certain tests that we don't get enough of, we send them out to a company called MedTox. They're usually like our drug screens, to make sure people are taking their medication, is also another one, or ARUP, which is a lab out of Utah. So we do send them around the United States. So we have couriers coming all day long and going. So
okay,
a lot of stuff. Yeah. So this is what I had to study for the most part in college: hematology, which is a study of blood and blood cells; microbiology, blood bank. So if somebody needs a unit of blood, or we do ROGAM workups. So if you're a woman and you are RH, like you're A negative, so you're RH negative, you usually have to get a shot of ROGAM, because you don't know, gets into specifics, but if your baby is positive, you can cross-react and have a reaction. So that's what we do a lot at Northland. Immunology, urinalysis is pretty self-explanatory. Point of care, those are like our strep test, influenza, and then coagulation is like blood clotting. So you may know somebody that's on warfarin or some sort of anticoagulant. So, and then we do have job shadowing available. I have one that graduated last year, who's waiting to job shadow, but we obviously can't do it right now. We have limited visitors and stuff up at the hospital, but it is, it's settling down a little bit. So I'm hoping by Christmas I'll be able to get her in. She's at college right now. So Lexi Broughton.
Oh,
so
great.
I'm hoping to get her in.
Lexi is a health careers exploration class alumni. She was in this class.
See? Heck yeah.
That's good.
So yeah, I've been trying to get her in, but I couldn't do it. We had students that they had their clinicals delayed because they were not able to, we weren't allowing students even in. So
yeah,
it was pretty crazy. So
okay.
Any questions?
Yeah. I asked Kendall yesterday, I was like, is there anything you want me to ask your mom? And she said, no, we kind of talk about this stuff. And so I was like, well, that's great. But I mean, I got to come up with some student questions.
I'm a fountain of useless knowledge. Go for it.
Okay. Well, I'm going to stop sharing my screen here. And I think we're back to just you and I. So,
okay.
I do want to, I'll fast forward through some of these questions a little bit, because in the middle, it asks, I am kind of curious about a typical day. And if you could think about like pre-COVID, if you even remember what a typical day was pre-COVID, and then like it says post-COVID, but we're kind of in the middle of COVID. So if you could just, kind of compare and contrast and tell us what a typical day is like in the lab.
So usually we have 3 techs there during the day. So we kind of are staggered. And then we have 2 that come in the evening. So we have, you name it. So what happens is we also draw for the emergency department. We draw for upstairs on our med surg and birthplace. So we're kind of busy 24/7 at the hospital. So when I come in, usually it's, okay, what's going on? What can somebody hand off before they're going home? So, definitely lots of communication skills. So you have also phlebotomists who are out front drawing patients already. So you get their specimens, and then we have to put them in a centrifuge, spin them down, take care of all of our samples that we can take care of, and run the tests. It's very fast paced. You don't sit down much, which I like, and it changes every day. So, I mean, you could have a day where you're just kind of like, and then you have days where your overhead is like rapid response or code whatever, and you see it all. So when we have some of those rapid response and codes, we actually go down to the emergency room, and we are part of that because we get the blood samples, or sometimes the nurses will pull them off of an IV start. And but we're in the thick of things for the most part. So yeah, so I mean, basically running samples, you have to be pretty meticulous and pay attention to what you're doing, obviously. Always checking. Number one mistake is a clerical error. Hey, there's a urine sitting there. Hey, it doesn't match the name that's on the urine. That's not good, you know? So you always have to be pretty meticulous and be able to communicate with your providers and other lab members. So.
Yeah. Has much changed for your position? You know, just working at a hospital now that we're in the middle of a pandemic, or do things feel kind of like they should, or they always have?
It's changed. We're all wearing, we didn't have to wear masks in the back. I mean, we always had eye protection, but, and gloves and a lab coat, but, it's definitely changed. I can remember the first 2 weeks of COVID when literally there were 6 emails sent in a day, and I couldn't even keep up with what they're like, nope, you know, you're doing something and you're like, well, they said to do it this way. And it's like, oh no, that changed 2 hours ago. Oh, yeah.
Yeah.
So initially that's what it was. It was just like, I'm not even going to read my email till the end of the day, and somebody tell me if I'm doing it wrong.
Yeah.
But that was mostly about getting COVID samples. So,
okay.
And how to, you know, make sure we're working. We have like a fume hood, or biosafety hood. And so we had to get the samples. We had to have the samples in there with a face shield and a face mask. Well, initially it was just a face mask. Then we went to eyewear. Then you could wear eyewear plus this. Yeah. So that's about the only part that's changed. Or if you're going out like into the general like emergency room or med surge upstairs or birthplace. So they all have, now everything has to have a COVID test. So our surgery department was closed for a while, except it was only emergent surgeries. So now everybody has to come in and get a COVID test before their surgical procedures. So, you know, that's about the only thing that's majorly changed besides our PPE or personal protective equipment. So other than that, it's just all, it's just COVID. That's all I got to say.
So I did hear you talk a little bit about some soft skills, and we're trying to focus on that, especially in a career-based class like this one is. So, you know I gave you a little bit of background before we were recording, but a few years ago, Princeton High School did a really cool thing, and we partnered with some community businesses like Fairview for sure was one of them, and the distillery and Crystal Cabinets and a few other places in town. And we asked those employers to identify the skills that they're looking for in future employees. And then our job was to take those skills and try to teach them explicitly and implicitly. So the first one on the list was communication, but also teamwork, self-management, critical thinking, and accountability. So if you could just kind of talk, teamwork was the next one on the list. If you could kind of just talk about what that looks like, sounds like, or feels like in
every
your
day
specific job.
Every day. It is not an option. You have to be a team player. You're communicating with doctors, you're communicating with nurses, you are communicating with your coworkers. I mean, when we are working in the lab, we kind of rotate positions. So I may be in blood bank one day, I may be in microbiology one day, I may be in chemistry one day. So you're yelling, it's not a huge lab, but you're yelling like, hey, Cassie, did you get that done over there? Or, hey, so-and-so is calling. I mean, it is a continuous communication and teamwork. And a big thing too is showing up for work. You have to, this is not a job where, I mean, things can happen if you don't like show up. I mean, we can find replacements. It's not that the world is going to end or anything, but it is, you need to be reliable for sure. And you need to want to be there. So, because it's a serious job. It's like, as far as anything in a hospital, you don't show up, a patient may not be able to get, something done or maybe missed. So, or delayed.
Well, it sounds like, if I'm unpacking that a little bit, it sounds like self-management, which just happens to be the next skill on the list. So you did a pretty good job transitioning into that one and talking about how important that is. Self-management, discipline. I think those two are kind of the same. So critical thinking and accountability are the last two. So if you could think of some examples or, what that looks like, sounds like, feels like
sometimes
in the lab.
Yeah, for sure. Critical thinking every day. That's part of our main part of our job description is critical thinking, because you may get a chemistry result and you look at that and you go, that doesn't look right. So we've had it happen before where sometimes we get home healthcare nurses or whoever, some people make mistakes, but when they draw off an IV start, they're supposed to flush the line with saline. So we ran a chemistry test and the potassium was sky high and other things didn't look right. And then when we spin down the sample, it's supposed to be kind of yellowish, but not, it's kind of like an amber color. But this one was pretty much clear. It looked like water. So you use your critical thinking and go, that sample doesn't look right. What's going on? Why is this potassium, like 7 something? And their last one was 4.2. So what happened is the nurse didn't use, or the nurse sent us her waste tube, not the actual specimen. And so you have to be, a little bit of a scientist to figure that all out and, make phone calls, figure out what it is or questions. We've called doctors before too. We're like, are you sure you want to give them 2 units of blood? They really don't need it. They, that kind of stuff where you're calling other people to just have a conversation with them. And you do have to be assertive. You have to be willing to put yourself out there and sometimes look like an idiot and sometimes be treated like an idiot because some people don't like you questioning them, but it is what it is. You're doing it for the patient, not yourself. So
right, and that would probably come back to communication and teamwork, and all those soft skills definitely
all of it
kind of tie themselves together. So that's really good perspective. I'm glad that there's people in this world that teach those things as well and reinforce those things, because sometimes kids think, oh, it's just a teacher telling me to do something at school.
No.
Absolutely, those things are important in the real world. So thanks for helping me reinforce that.
You bet.
Vocation, not vacation, but vocation is is something that I try to get these high school kids to start thinking about, and really vocation is the feeling of being called to a profession. And I know you talked about how much you enjoy your job, and it sounds like you're passionate about what you're doing. So could you just talk about kind of your journey to a vocation and feeling passionate about your work and thinking about what's rewarding about it?
Yep. So like I said, initially I went to Anoka Ramsey Community College because I knew I liked sciences, but I had zero idea what I wanted to do. I didn't want to go to medical school. That was too much for me. And so I was kind of hemming and hawing over just biology, or maybe doing, something like physical therapy or something along those lines, because I played softball and volleyball and that was my jam. So I kind of fell in love with, my anatomy and physiology and my first microbiology class. And, obviously I knew I liked sciences. So that's kind of where, when I went to Anoka Ramsey, I took all those science classes and got kind of my generals done and then transferred. And they had a microbiology degree up there and I loved it. And I don't know, it fit. It was easy. There was other people like, because up at NDSU they have a pharmacy school, and so I took most of my classes because we had to have 3 years of chemistry, and so most of the pharmacy majors were all in my classes, and they're like, "Oh my God, I had to take microbiology. I hate it." And I'm like, "Really? Microbiology compared to learning like every single one of these drugs and what they do?" And I'm like, "No, thank you. It was not for me." So everybody has their own thing. I mean, one thing with lab is it is more of an introverted medical field, more so. I mean, I'm better one-on-one with people than I am with large groups. So my dad was a teacher, my husband's a teacher. Nope, it was not for me. I'm better with like individuals. Like I can take a patient and I can walk them here and draw their blood and talk to them, but I'm not very good at like larger groups and that kind of stuff. So I knew that this was kind of for me, as far as I get to be in the lab, I kind of get to be in the background and just deal with a few patients here and there. So if you're extroverted, most of them go into nursing or, you know, that kind of stuff. They're more into the one-on-one patient care and taking care of stuff too. So
Yeah, well, there's definitely sounds
my
like
personality.
yeah, it sounds like there's been some serious self-discovery and you know where you're a good fit. And I think that's really important. You know, you don't want to try and fit somewhere that is not a good fit for you. And sometimes that happens. You know, kids get locked into a certain track of thinking and, you know, figuring out what you're good at and what's going to be a good fit is really important. So thanks for that.
And real quick, another thing, when I first got out of college, I got hired by a temp through Kelly Scientific, and I worked at Boston Scientific for about 6 months. And one thing, when you're a temp employee, you don't really get benefits and that kind of stuff. So I took my other research job after that. But would you work for someone like Boston Scientific or Medtronic? So my younger sister and I had the same degree, microbiology, but she works at Medtronic. So we have the same degree, but a totally different area. So she works with all the medical devices and that kind of stuff. And that's what I did for about 6 months. But for me, that was boring. I liked, because everything has to be sterile. So they go into different rooms, clean rooms where they're doing their stents and a lot of the medical devices are being made. And they have to go in there and make sure that the room is sterile. So you're looking for zero growth on any of your plates or any counts. And what I liked was finding the bugs. So that's why I decided to go another direction. So, but she loves what she does and I love what I do. So
I think that's really good perspective. And you know, the person I talked to last week, Tanner, talked about taking your first job. You know, it might not be exactly what you think it's going to be, but being open being open to a new experience and a different experience, and eventually figuring out what you want, even if you don't know in that exact moment. I think you know, it sounds like your journey is another really good example of starting somewhere and then, you know, letting that evolve and letting that open some doors as you move forward.
Take it. You're always going to learn something.
Yeah.
Whether you learn you like it or don't like it, you know.
Those are both important
you'll
things.
figure it out.
My dad always used to say, you got to learn what you don't like to do too.
Yep, exactly, for sure.
Our current learning conditions, so, you know, meaning distance learning and going to school in the middle of a pandemic. You know, our very first class together, our first in-person class together, we talked about change. And, you know, specifically, we watched, I don't know if your daughter Kendall mentioned anything to you about Who Moved My Cheese was the name of the metaphor that we watched.
I think that's a book, isn't it?
It is a book, and it's been around for a while, but we found a YouTube video and we watched it instead. But it just talks a lot about being open to change. And, you know, it was kind of like what we talked about, but, you know, using the pandemic and using our current conditions, not to dwell on them, but say, you know, this is where we're at and this is how I can make the best of things. And can you think about a specific time or a specific thing that's changed since the beginning of your career to, you know, where we are now?
Besides the obvious
yeah,
COVID.
besides the obvious pandemic, I think that'd be an easy one for anybody now. But anything else that you can think of that has changed, either for you personally or in your profession?
Not a lot. What people also don't realize is that we work with a lot of machines. So you also have to, what'll happen is like labs, also have lab software. So when we run something on a chemistry analyzer, that analyzer translates it to our lab software. And then our lab software converts it into our computer system so the doctors can read it. So it's quite the process. So I've learned basically how to fix things. I've always been kind of pretty good at that, taking things apart and putting them back together. But we do have, people from like our heme analyzers, the company's called Sysmex. So Sysmex will come in and they'll be like, okay, we're going to fix it or replace this pump or do whatever. But a lot of it, you're relying on machines. So you've kind of learned how to be a little bit more self-sufficient or try and fix that kind of stuff yourself. So that way you don't have to call repair. But sometimes you do, and it kind of puts a kink in your day, and you have to send samples elsewhere. But adaptability is a huge one because you don't know what the day's going to bring. So.
Yeah. Can you tell us, this is question number 7 on our list if you're following along, but can you tell us about someone who's mentored you or somebody you've learned a lot from, either professionally or personally?
I would say Marge. When I did my clinicals at Mercy Hospital at Alina, I was a student. When I was doing my clinicals, I was at Oak River Clinic, the Alina there, and we had a patient come in, and he had a really huge white count, and he said he wasn't feeling great. He was tired all the time. So he had a really big white count, which means usually have some sort of infection. And he ended up having cancer cells. So when a week later I went to Alina at Mercy Hospital, he was there and he was getting a bone marrow. So as a student, it was kind of cool to be able, and so Marge was there that day. And she's like, Diana, when you come to Mercy, you'll be able to see our patients here, because we have something called HIPAA, so we can't talk about patients' names and whatever. And so she just said, our patient. And so I got to see him. I basically drew him that day, got to look at his cells under a microscope. And 2 weeks later, I was at Mercy and I got to be in the room and help observe for the bone marrow of this gentleman. And then I got to look at his cells from here on out, and he was going through chemo and radiation, and they had set up a plan and had a visit with a pathologist. So she's kind of the same way that I am about, look at this. This is so awesome. I mean, it's horrible for the patient, but there's that part of you that's just like, this is awesome. As a student, you get to see that like right up front and follow that patient. You usually don't get that opportunity. Usually it's like, okay, there they go, and off their treatment plan. And so I got to know the guy pretty well as well. So, this was like 10 years ago, but
I would think the potential for discovery is just tremendous in a job like yours. So you're able to be on the front line and say, this is what's happening here, or this is what we think is happening. So I would think that's a pretty rewarding thing.
It is, very much so.
This is a question with a little bit less depth, but I still think it's definitely worth asking. What is your dream job besides, your current position, or what did you want to be when you grew up as a middle schooler?
Ooh, believe it or not, a marine biologist. Didn't everybody?
Yeah.
Went with the dolphins?
Yeah.
Come on. Or I wanted to be a vet. I love animals and that stuff. But right now, as I'm older, I would say I would love to work for National Geographic.
Oh.
So doing one of those travel shows, or even just taking photos.
Maybe
that would be awesome.
Maybe you'll get to fly in a hot air balloon over Ireland.
Over Ireland. That'll be my next. That'll be my next adventure. I'll get right on that.
So a couple more questions here. And I've debated whether or not to keep this question on the list because, personally, I kind of hate this question, and I think it's kind of a classic job interview question. But where do you see yourself in 1 year, 5 years, or 10 years?
Oh boy, I don't want to see that far, because it means Kendall's graduated and off and doing what she's supposed to be doing. Let's see. I think I miss a lot of the microbiology stuff. We don't do a lot of that. So there are times when I would like to go down to the U, go back to the U and work there. But I like the small hospital atmosphere. So I don't know. And I'm not huge into like management roles.
So
I don't know.
if
It's a
you,
really
I mean,
tough question.
it's okay to say right where you're at,
Pretty much right where I'm at right now. I mean, maybe once my youngest is graduated, I might consider going down to the U and working in the microbiology department there. But right now I want to be around for my kids' stuff, and I'm 7 miles from my house, and you can't beat that.
Yeah, I think that's great. I think that means you're doing what you're supposed to be doing if you don't want to be doing.
I think so.
So the last question on the list before we finish with another kind of fun chat pack question, but if you could give yourself or any high schooler in general some career and educational advice, what would you tell these health career kids if they were pursuing a health career or any career in general?
I don't want to sound cliche, do what you love. But it's true. I mean, work can be tough. It's exhausting some days. I mean, you have good days and bad days in any career, any field. It's just a matter of what you can put up with because you love what you're doing. So, I mean, I'll have a day where I'm having just a really bad day. I'm machine's down, this is going on, we're super busy. And then I see a patient and I have, I'm maybe drawing their blood or just talking to them, and, they just say thank you, or, we really appreciated everything that you're doing. And that's really all it takes. You're just be kind to people. That's all I guess. Yeah. Everything in the world right now is pretty crazy. But if you do what you love, I mean, find something that you love and then just excel at it. It's never an easy road. So, like you said, you kind of have to do some things in order to fail, and doesn't mean you weren't meant to do it.
Yeah, and that's okay. Sometimes it's okay to fail. It's okay to make mistakes. It's okay. Yep. There's a lot more learning that happens because of failure than for sure. If you're excelling at something. So I think that's really good advice. Okay, here's our final chat pack question. If you could bring back any trend or tradition or fad that seems to have faded, what tradition or fad or trend would you like to bring back?
Oh God, I'm totally embarrassing Kendall, but grunge. Come on.
Oh, 90s grunge. I like it. Nirvana, I'm into that. Pearl Jam,
Totally. Pearl Jam. Come on.
I'll play some Pearl Jam for Kendall next time.
He probably already knows that. So
good. All right. Well, Diana, I really appreciate you doing this. And, obviously in an ideal situation, we'd love to have you in class. So I'll keep you on the list for future years. But all things considered, I really appreciate you being able to take some time and have a digital conversation with us.
You bet. If they have any questions or looking to do any job shadowing, just let me know.
Okay.
We'll see what we could figure out anyway.